All right, who else do we have? Put it in the chat here, guys. We're so happy that you're here joining us. We are going to get right to it because we know that we have a lot to cover, and you're going to love getting to hear from my girl, Jackie here. Jackie and I were both nurses together. She would come and kind of float to the different floors. And so I always loved it. It was such a treat when she'd get to come to the floor. And every so often when the stars aligned, we got to eat lunch together. And then she went on to become a nurse practitioner during that time. Then she also moved up from Colorado to Sioux Falls, South Dakota. Belle Fourche. I knew one. Spearfish. I'm so sorry. Spearfish. Okay. I know a lot of places in South Dakota. I have family there. So I'm always, thank you. Spearfish. And she has been there for how long now, Jackie, up in Spearfish?
It'll be 5 years in September.
Okay, awesome. So you guys will get to hear from her and of her story. And one thing we're so thankful. Thank you guys for putting in the chat. North Dakota, we got North Dakota, we got South Dakota, we got Minnesota. Oh, we got Boulder, Colorado. Karen, hello. Caroline Reidig from Colorado. We have a great Zoom coming up with her next week. So wonderful. We're so happy to have you guys here joining us. And we are going to talk about burnout, because I know that that is something that is, I just did a post about 20 minutes ago. It is astronomical, the burnout rate. Yet we need healthcare practitioners, but the burnout rate, but we want quality people, but it's hard to get them to sustain, right? So we're going to talk about that. We're going to talk about nutritional approaches, things that have helped, what Jackie has found to help as a part of her story. I'll share a little bit of my story with my lifetime of food allergies and sensitivities. But we really do want to focus in, especially those of you that are healthcare professionals that are here to take a look. Have you been hearing about this whole gut-brain connection, the gut-brain axis, the microbiome? You've been hearing things, you've been reading, I have a good friend who's a physical therapist, has her doctorate of physical therapy, and she had a whole retreat for part of her continuing ed that was all in the microbiome and its connection to the brain. So like it's out there, and we here at Amari Global have been leading the way for coming up on our 5th year. So this really is our fastball, is this whole area of science. And we're just happy to have you guys join us. So before I introduce Jackie, for those that don't know me, my name is Janelle. I'm married to Andrew. We have 4 kids. We homeschool, and we are some of the founding wellness partners here at Amari. My background is in nursing. I'm no longer a nurse, but once a nurse, always a nurse, right? I get to use it either on Andrew with his epic mountain biking injuries or with my kids. So Jackie, tell us a little bit about you and kind of what brought you here tonight.
Yeah, so I am also married and also have 4 kids. I have all girls, and I have been a nurse since 2003, and then got my nurse practitioner in 2008, and have worked mostly clinic work since that time, but mostly urgent care. So still the long shifts and lots of patients. So worked through the pandemic, seeing a lot of COVID. So that's been, as you talk about burnout, I can definitely speak to that. So that's what I do now. And then I was introduced to Amari Global about 3.5 years ago. And I'll get into more about my story and what brought me here. But that's kind of a little bit about my healthcare background.
And why do you think, Jackie? Because I know last time I worked in a hospital setting, like the busy hospital setting, I mean, it's actually been a while because I went on to do surgery and it was more surgical center. It was different, but I started to feel that. And that was like, I don't even know, 8 years ago, before obviously COVID. Like, what do you feel like with the burnout? If you could just in a couple sentences, why do you feel like there is so much burnout? We all think about like what the last 2 years has been like, but anything else you want to say about that?
Yeah, it's really hard to put into words. I think that there is a lot expected of us. And so, just the demands physically to work and see the volume of patients. There's less people. I read like through COVID, 25% of nurses left that first year. Again, I'm a nurse practitioner, but it affects us because I often work with just one nurse. And so I think it's the physical demands. I think mentally it's really exhausting to not be able to help people. when you're constantly diagnosing something that, usually there's something I can fix, but with COVID, there wasn't much fixing there. It was, there wasn't a lot. There's a little bit more treatment now, but that was difficult. And I just think healthcare has become very complicated. If I could sum it up in a few words, it's just, it's so much more on the reactive rather than the proactive. And so you're just trying to put band-aids on everything. And that's just not in a lot of our human nature. We want to be able to help people. And so our model is just really shifted. So that has made it really hard as well.
So I guess let's jump into your story a bit. When we first talked about the gut brain connection and Amari, we were having this conversation. I'll never forget where I was in the parking lot of going into yoga. And I remember I was talking about this, and maybe just give everyone a glimpse of where were you then to the point when you reached out? Was it health? Was it the plan B part? What was it for you?
Yeah. So when I reached out to you, I was about 3 years after I had my youngest daughter, who's now 8. Or maybe 4 years after I had been struggling with some health issues after she was born that really they couldn't put a name to, and I think they're really common things that I used to often see women in clinic for. And it was just fatigue, very stressed, digestive issues, a lot of bloating, weight gain, just a lot of things that, my thyroid wasn't off. I had all the labs done. I was working out regularly. Me and Janelle went to CrossFit together at 5 a.m. in the morning. And so, yeah, so I was doing all the things that I knew to do, especially with my background. And yet I was still struggling. And I would say burnout would be the best description, because I felt at the end of my rope at home, at the end of my rope at work, I just felt like I was constantly overexerting, mentally, physically. I felt exhausted at the end of the day, to the point my kids just kind of knew not to bother me. When I came home, they just kind of left me alone. I would say goodnight. That was about it. I just felt like I had nothing left to give. And so I had heard Janelle speak to the gut brain connection. And that was new science from when I went to school, because it's now been 14 years since I got my nurse practitioner. And so I really began to dive into that research. And that was what made me really reach out to her and say, tell me what this is that you're doing. I wonder if this could help me with what I'm dealing with. So that's what brought me to evaluate Amari. The funny thing is, I was very anti holistic health because I knew of a couple practitioners that I had dealt with in regular medicine that maybe took it a little extreme. And so I actually had a prejudice against it. So it really caused me to sit back and look at the science and really evaluate the research. And I was like, oh, I'm wrong, definitely wrong with this, that I should not have had that prejudgment. But that is what made me open to look at Amari.
Okay, so I'd love to hear, because we have a lot of people that are joining us on this live Zoom. What just jumped out at you? I'm not even kidding. I just got goosebumps, and I've known you for years, Jackie, because I think all of us, regardless of our background, career and family, we've felt that burnout. We felt that, I don't know if I have any more to give. Maybe we've experienced feelings of depression or anxiety that's associated with it. And I know when I look at times when I've been in a rough spot, it's so hard to reach out and even have hope in something different. I just know I felt that. And I wonder who else maybe in the chat, if you or somebody, has really worked through that. And so I'm so thankful. And I love how you just put that in words, because you kind of step back and said, let me take a look for myself. Let me see what this is. And is this real science? Is this, frou-frou stuff? So I love that. So you're doing that, and the difference that you felt just in your body, how did that change your days? Because I think we're all getting a picture of that. You're at work, you're going, maybe getting a break for a meal or something. And
no breaks.
Home. No breaks. Okay. Yeah. And then you come back and you like want to see your people, because this is like part of our life dream. Perhaps if you have people that, you know, that you, a spouse or a partner or kids, you come home and you're just so exhausted, or maybe it's even just a really dear friend or a family member. And when you don't feel like you can pour out anymore because your cup is totally dry, then it's hard to have that. So I'm just looking, like, tell us how this has changed for you. And I'm looking in the chat. One thing Caroline says is, I believe as women, we feel we really have to hold it all together for everyone. Would you say you felt that?
Yeah, absolutely. At the time, you know, years ago, my husband was still in school, so I was really the breadwinner too. So I did feel the pressure that I just had to fight through it. I just had to get through it. And I didn't really know or think that there was another way or another option. So once I started on the products with Amari, I had such a significant impact with my own health. And that is what, of course, brought me here to share this with other people. But to put that into words, I guess to sum it up, is I finally felt like I had that stress resilience. When you hear Dr. Sean Talbot talk about that, that is the two words that I would say describe what I shifted from. Instead of burnout, I had stress resilience. So I felt like a new calm. I felt I was really fatigued all the time. So, you know, switch that to like feeling like, oh, I can get through this day. I mean, 12-hour days are long days, but I would come home and feel like I had more to give mentally. I was able to like read to my kids and just feel like I had more to get. I didn't need to just check out because I just had that stress resilience and I had the energy to keep going. And physically, it affected my body as well. So, of course, you know, our mental health and our physical health are tied together. They're not separate. And so I lost weight without changing anything. I was already working out. I was already eating right. So that wasn't the problem. Really getting that gut brain axis, you know, optimized and getting, you know, better sleep and getting that stress under control made all the difference for me. So I do know, I think in the first couple of months I was on product, I lost almost 10 pounds without doing anything different. And I had been, my youngest was like 4 at this point. And so I had been trying since she was born to really, after my other kids, I was able to bounce back, but really after her, I wasn't. And so it finally just something shifted and I was really able to, you know, have that physical health difference as well.
That's awesome. And one thing I want to point to, as far as some of you guys are like, all right, I'm feeling the feels and like, okay, these girls seem legit, but like, give them some numbers. And I just want to throw out there, Jackie talked about burnout, and the actual psychological term that is the opposite of burnout is vigor. vigor. And that is the term of vigor. When you feel like you have that drive, you're feeling like you have more to give, that's vigor. And so even like one of our numerous studies showed after 30 days, excuse me, and this is for people who were already saying like, I feel pretty good. They measured on average 44% higher vigor after 30 days by addressing specifically the gut brain connection with one of the product packs that we have. Also 64% lower fatigue. So I'll pick one other one. I mean, 55% lower depression. Okay. And 45% lower tension. Like, I think when you look at our world, you see how fast paced it is. And you think if any one of those things were to be a real thing, like for all of us who are listening, taking this time, investing in yourself tonight, how would that change your days? That's really the question I guess we have for you is, how would that change your days, your relationships, your career, your health? Like maybe you now have the desire to go to the gym, desire to do those things. So yeah, Jackie, I mean, can you speak a little bit to then when kind of out of the blue, you had a diagnosis that literally put you on your back?
Yeah, absolutely. Yeah. So, and just going back to that, just one more thing I want to say, when you say, how did it change your days?
Yes.
What I could say is my days looked like, a couple weeks into product, I was feeling these differences myself, but it just goes to show how much the way we're feeling impacts those around us. I can remember my third daughter coming up to me like at the end of like a day when I had come home from work, and she said like, "Mommy, will you play with me?" And it just dawned on me, like she hadn't asked that in like months because she just knew that I just didn't have that in me. And so that's how it changed my days, is that, I felt like my kids and my family got like the best of me instead of just what was left, and the rest at the end of the day. So that's what it did to change my days. So yeah, fast forward to, it's been almost 3 years now. So May of 2019, I had a herniated disc in my cervical spine that was into the spinal cord, and it caused severe weakness in my upper limbs. Like I wasn't able to even lift an otoscope to look in a patient's ears. I had no grip or anything. So it was truly an emergency. So I had to have a surgery to fix that problem. And I had a cervical disc replacement, and was coming along. My surgery went well, and I had some issues with inflammation and like allergic reaction and stuff to meds. So I was on steroids. I actually was off my products. I wasn't allowed to take them for 2 weeks before surgery. And then after surgery, because of all of the problems, I was on dexamethasone steroids. So I still was not back on products. And I was actually preparing to do a reboot when I fell ill, and my symptoms started like, it felt like my issue with my neck was coming back again. Like I was noticing weakness in my arms, but then I developed a really high fever, and the weakness progressed rapidly to my legs, and I wasn't able to walk. I was in the hospital in Rapid City for 4 days, and they couldn't figure out what was wrong. The funny thing about that is one doctor said there was nothing wrong with me. And even though I couldn't walk. And then I was transferred by ambulance across the state to Sioux Falls. And that's when I was diagnosed with a really rare condition called transverse myelitis. So it's basically like an attack on your spinal cord. So it causes a inflammation and a scarring on your spinal cord that never truly goes away. So recovery is variable from person to person. Only about a third of people recover somewhat completely, and less than 10% are, as functional as I am. So that's where the past 3 years has been. It's been a very long journey. It has not been easy, even though, I'm doing well now and pretty much functional. It's been a very, very difficult, emotionally, mentally, physically. It took me a year to be able to work an entire shift and be able to stand up for a whole day. And it probably took me about 2 years before I could just take care of the house and do all the things. Like my kids had to do a lot of stuff. My mom had to do a lot of stuff. Like I wasn't able to do laundry, and I wasn't able to clean. Like I wasn't able to scrub things because of the weakness in my arms. So so it was very difficult.
Yes. And you had said that it was around 1% or less than 10 to be conservative percent of people that are functional, that are actually then able to go and be functional. So I know we're gonna talk about some of your favorite products, but how are you feeling now? Like, right, how are you feeling in your day-to-day right now? You're able to go part-time. So you have your MRI business as part of your time, and then you have working as a nurse practitioner for part-time. So how are you feeling now? How are your days different? And like, give people kind of some hope that are looking at whether it's their health or the career side.
Yeah. So I'll speak to the health part first, and then I'll talk about the career. So the biggest thing that I learned through this process is, again, I mentioned how medicine is so focused on like a reaction rather than like being proactive and preventative. I think if I hadn't been, like, I was running and I was eating really well, I was taking my MRA supplements, before the surgery and everything. So I feel like if I hadn't already been doing that, the recovery could have looked a lot different. It could have been much worse. When I look at where I'm at now, I'm probably like 80% recovered, I would say. I was an athlete and a runner before, so I can't run or do anything like strenuous jumping and things like that, but I can bike and I can walk, and the weakness in my legs doesn't come as quickly with those sorts of activities. So I'm still seeing progress over time, which is actually not what the literature says will happen. It basically says that you won't recover after 2 years, but I have continued to see improvements, very small, but I've still continued to see improvements. The Amari products have been just huge in so many ways through this whole thing, because I was extremely immobile. I was 2 months off work and I wasn't laying down in bed most of my day. I could maybe sit up for 30 minutes as all my body could handle. And so I didn't gain any weight. In fact, I continued to lose weight through this, just with doing, the GBX foods and, continuing to stay on my protocol, continuing to eat mostly like a Mediterranean diet. I wasn't like restricting in any way. I've been in physical therapy, and I'm still in it. So that's like my main form of exercise, and then walking outside. So I just do what movement I can. So, I just want to encourage you, no matter what your fitness level is, every little bit counts, and just do what you can. And then the Relief Plus has helped so much with the pain. I have a lot of nerve symptoms. And so it's nothing that really, like, I've never been tolerable to pain medications or anything like that. A lot of patients with my condition are on chronic pain medicine. But I've been able to, for a long time, I did have to take ibuprofen in addition to Relief, but now I just take Relief twice a day.
Awesome.
And then, so that's kind of where the physical health part is. I would say, as far as my work and my career and just kind of that impact that, I went into medicine for. When I was sick in the hospital, I remember thinking, like, oh my gosh, what am I going to do if I can't do this ever again? Like, what am I going to do? And I had already joined Amari as a wellness partner, but at that point, my nurse practitioner career was very full-time. And, this was very part-time, which is okay. I was still earning a good side income, but it just made me see that, there's an opportunity here to earn income that could replace a career income. There are a lot of people that are doing that. And so it really made me shift. It was something I could do when I was laying in bed. I know Sarah Hine would comment sometimes when I'd be laying down in my bed on these Zooms, and but yeah, it is something you can truly do no matter what condition you're in, no matter where you are, no matter what you're going through. I was able to still build my business, and it's more than doubled since that happened. And so it really made me see that there's another avenue, and it's so important to keep an open mind for what's out there, and definitely, like, more than one stream of income is always a good plan to have, because this was very unexpected, very rare. We don't plan for things like this, but I'm so thankful that this was already in the works and already, something that I could just plug into.
Yeah, so good. All right. Well, you just led into this perfectly. And just so everybody knows, I was just looking, Jackie, actually at the post I think you had today, where you're showing off like your six pack. You're very humble, that I can see. And I love that, because you're looking at health, right? We talk a lot about zooming out and what is the goal you have for your health. And now let's take a look. What could be an area, whether we're talking about sleep or nutrition, just like specifically what we're eating. Could it be the stress in your life? Could it be burnout? Like, what is maybe the thing, if you had to choose something that your gut's telling you, now let's work on that, and let's strategically work on that. And one of our favorite ways to work on that and start getting some traction is what we have called our Healthy Mind Pack. It's just one of our many packs. We want to highlight that tonight. And so while you talk about it, and like real quick, because we have just a couple more minutes, we'll talk about some of the benefits here. Okay. So we have our Energy Plus. How do you take this every day? It's in a little packet. How do you do it? Hot, cold, straight?
I like it hot, and I mix mine with my Edge, and I'm really a fan with the grape Edge with the pomegranate energy. And I do it at work. I love it. It really gives me a good laser focus where I, can keep everything straight and really, just stay on task. It's great.
It's
Yeah.
without the jitters. It's really working
Yeah.
on relaxed alertness, we like to say, guys. So
Right.
all of our products being focused on this gut-brain
Yeah.
connection. And we do have a download for all of you guys tonight. I'll put it in the chat here. Just in a minute. You also can, if you guys are watching the recording, just ask the person who invited you for the mental wellness toolkit, and they can give that to you. It's about 5 pages, has some tips, and also has some numbers. So my people who are like, give me the numbers. What does this really look like? What percentage of better sleep am I going to have on average? What is that going to look like? We have that for you. Okay. So the mental wellness toolkit is our little gift for everybody tonight. And the other 2 parts of our healthy mind pack, which if you're listening, last day of the month, May, we have an awesome special that ends tonight. Like it ends tonight. It's not going into tomorrow. It ends tonight. So if you're brand new, that is 20% off. Once you have $149.95 in your cart. So talk to the person who invited you. Super great deal. I got somebody started with Healthy Mind Pack plus some kids mood for his son, and it came out to be $125. So pretty sweet. So we also have Mental Focus, really working on the circulation up to the brain. These are just 2 capsules a day. I know that's a little bit blurry. And then we have Mood, which I want Jackie to share a little something about mood. Because I didn't use this when I first started with Amari. I didn't use it right away because I thought, personally, I at that time was like, I haven't really struggled with depression or anxiety, so maybe I don't need this. But what I found for me is it had another benefit. But Jackie, I want you to say first what you noticed with mood.
With mood, I feel like with mood that it just gives me like an optimism. I'm generally a happy and optimistic person, but I especially like to take it if I have a really extra stressful thing going on, like like a road trip with my kids, or I really like to use it for things like that. But there's a lot of benefits with ashwagandha that's in the Mood Plus for women's health, for hormone balance. So I actually noticed a big improvement in that area of my health, in the women's health area, with cycles and things like that after I started on that. And then my other little favorite thing about Mood Plus is my 81-year-old dad and my 77-year-old mom both love it. And they fight over their mood on who needs it the most and who gets to take it.
Oh, that's so funny.
So I often give them some because they just love that product. So yeah, I love that it's a safer option too for someone that age. Yeah.
That's so good. It's fun that they can even use their reward points probably for extra mood. I know what they're probably using those points for.
Yeah.
So that's awesome. Well, guys, I'm so thankful that we could have this conversation tonight. And just Jackie, thank you. I really truly had chills a few times as you're talking about this, because we want people to know that there are options. And maybe you're someone that kind of came tonight because you're really looking at the products. You're like, are they clean? Are they science-backed? In fact, we've been nominated for 6 awards across the nutrition space. This is not just in the direct sales space. 6. We've won one of them, and we've had runner-ups for some of the other. We were just recently nominated for Best Probiotic of the Year with our GBX Fit, the one that's targeted for weight loss, the one you posted about today, Jackie. So that's huge, because this really is our fastball, is this whole area of science. So if you haven't experienced it for yourself, we want to encourage you, be like Jackie. Hashtag be like Jackie. Step back, throw off what you think it might be, and give it a shot, and give us a solid commitment to using these products. I will tell you, for me, and if you want to read my full testimony with my food allergies and sensitivities, just ask the person who invited you or message me, Janelle Devlin, on Facebook, and we can tap you into this. But I had food allergies and sensitivities my whole life. I mean, I look back, I'm like, oh, that's why that would happen when I was a kid. But for sure, I was diagnosed in my 20s, early 20s, 21, and I had to be gluten-free and dairy-free. And I had a solid 12 years that I was gluten-free and dairy-free, did all sorts of programs, thousands and thousands of dollars with some really great functional doctors, you name it. I probably tried it. And I only could get so far. And I didn't know what to expect when I started with Amari. I just thought maybe it was something that I could have some hope in again for something different with my digestion. And for me, I experienced a lot of things over my first 4 to 5 months, but right at about the 5-month mark is when it was like a light switch went on. I was very consistent with my eating, the kind of foods. But with my program, 5 months in, I felt a big change. And long story short, I don't have my food allergies anymore. I mean, I can have gluten, I can have dairy. If I were to have too much or be eating like donuts or croissants my skin will start really breaking out, but I don't have the same reactions, the rashes, all the IBS symptoms, all the gut stuff. So again, happy to share more about that. But tonight we're so thankful to hear your story, Jackie, and how you experienced such an increase in your quality of life. And then to be able to work through and be one of the small percentage of people that's so functional with the transverse myelitis. And we're here to say, guys, we're here to cheer you on. And whether that's with the product side or the business side, like this, it has been incredible for us to be able to build healthy incomes alongside great people. And you guys in the chat, tell me, yeah, am I right? Am I right? We have an awesome community. We have an awesome community.
Absolutely.
Monday mornings are fantastic, right? We start with we have our team call in the morning, and it's a great place to feel like you have community, positive, life-giving people. And we're just happy that you're here. So let us know, and whoever invited you, what that next step is for you. But we say, give us a shot. Let's jump in together and let's help you to move forward towards that goal you have, whether it's your health or whether it's that plan B in your career. Anything else you want to say to end, Jackie?
No, I don't think so. Just thank you for listening in and joining us tonight.
Yeah,
appreciate it.
Thank you,
Thanks
everybody.
for having me on. Yes.
Yes, those of you that are on here live, if you hang on, I'm going to put in the chat the mental wellness toolkit. For everyone else listening to the recording, ask for the mental wellness toolkit and we'll get that right over to you. It's an awesome resource. All right. Thanks, everybody. And we'll see you next week. Next week, I will be hosting again with Caroline Reidig. We're talking about aging, healthy aging. You're going to love this woman as well. Such a powerhouse. And so that's going to be the same time, same place, next Tuesday. Healthy aging, what we can do physically, along with our health nutritionally, and bringing that all together. So, all right, everybody. See you next time. Just putting this in the chat. Here we go.